what are the patient's expectation from premium IOLs? Everybody wants to have a spectacle-free life for their daily routine work with a good contrast without any glares and halos. So there's always been a quest for the ideal IOL. Now this graph tells us the functional outcomes of various IOLs. The multifocal IOLs, they tackle the distance, intermediate and near vision. However, there are associated glares and halos with them. The enhanced monofocals, however, provide an additional edge, providing certain amount of added intermediate and certain amount of near vision. So the IsoPure IOL by BVI is one of the new IOLs. It provides premium monofocal, it has a premium monofocal design providing functional intermediate vision without compromising on the simplicity of monofocal IOL, thus providing extended uncompromised vision. As compared to a monofocal IOL, there is around 50% increase in the depth of focus with just 12% decrease in the contrast sensitivity, thus providing additional 1 diopter extended depth of focus. When the IOL design, once we see this, it is, as sir also discussed in the previous presentation, it is a closed loop design with around 2 degrees of posterior angulation of the haptics. It is a hydrophobic acrylic glistening free material, and there are 2 injector systems. One is the non-preloaded, the other is preloaded. As we can see, the green line, this is the standard monofocal IOL. As compared to standard monofocal IOL, the isofocal technology which is there in the IsoPure IOL, they incorporate spherical aberrations across the entire optic diameter on both the anterior and posterior surfaces. Now this is what makes it unique and patented to BVI. As we can see here, along the entire optic diameter, there are changes of spherical aberrations incorporated in the IOL, providing progressive adjustment and improvement in the quality. Also, the IOL is customized based on the power. The anterior and posterior surfaces are relatively unique. Like in case of high myopes, in around 10 diopters, there will be a concave convex kind of curvature, ensuring that the lens sticks very close to the posterior capsule. This is how the various powers of the IOL that are available are customized. It makes a very good balance of the depth of the focus with contrast sensitivity and doesn't lose upon the advantages of monofocal IOL. There is no decrease in contrast sensitivity. The material used for the IOL is free from glistening. As we can appreciate here, this is the standard other monofocal IOL. When this has grade 1 of glistening, the BVI IsoPure IOL is free from glistening. This is our initial experience of how the IOL loading is done. Once we open this, we see that the IOL is there in the cartridge. We just have to fix it in the injector. So this is how it is done. Then it's a very simple technique. Once we bring it out, we can see that we have to add fluid here, and then the lens becomes freely mobile. We can see there is anterior movement of fluid and the lens. This is one of the, it also has one of the best delivering systems. As we can appreciate here, as we are injecting the IOL, it opens up very smoothly, and it is ensured that the leading haptics go directly in the bag, and thereafter the posterior haptics are tucked into the capsular bag. The post-operative results show that the lens is very well centered, and the anterior segment OCT of day 1 image shows that there is absolutely no gap between the lens and the posterior capsule. The long-term results are likely to show that this IOL will have less PCO rates. In our results, which we have implanted IsoPure Premium Monofocal IOLs, we have seen that it provides uncorrected distance visual acuity. Median value was 6/6. Very good intermediate visual acuity with a quite good near visual acuity as well. When there is bilateral implantation, the uncorrected binocular near vision was N8 in that case. There is also a review where multiple studies were collected and analyzed. On the results of IsoPure Premium IOL, it shows that it provides excellent uncorrected distance and intermediate visual acuity, and with a mini monovision approach, it provides useful near vision as well, with the advantages of monofocal IOL without any dysphotopsias or aberrations. Thank you.